Hello everybody. Diet in diabetes is a very interesting topic among the diabetic patients all over the world. Unfortunately, it is like that those people who are foodie, those who like to eat food, they land into diabetes. And these people every time search for that type of diet plans, that type of diet which will allow them to have more of the food what they like. As we have seen in the previous topics, that diabetes, or which is called as prameha in Ayurveda, basically it is the causes. If we see, they have clearly mentioned that it is a lifestyle and wrong dietary disorder. It is due to wrong dietary habits and wrong eating patterns. And what type of food? In the olden days, they have mentioned it very correctly that there are certain category of foods which can land a person into diabetes. And we will be surprised to hear that the foods we are eating in a regular fashion, which is said to be very healthy, and these are the causes of diabetes which have been explained. If we see the quotations from Charak Samhita, it has been mentioned over there that asya sukham swapna sukham dadhini gramya udaka anuparasan payansi navannapanam gudavai krutancha prameha hetu kafagrucha sarvam. So type of kafaja prameha, the initial stage, or what we can as a pre-diabetic conditions, then pre-diabetic and then diabetic conditions. So when we have such type of food which comes in a regular fashion in our life, we consume it in regular way, that can land a person into diabetes. No doubt they have explained that diabetes is a genetic disorder, but to express these genes earlier at a very early age, that this type of food is an important cause, and the first important thing is in that is curds or yogurt, what we call as. So consumption of regular yogurt and curd is not allowed in diabetes. Asya sukham swapna sukham dadhini, they have called, in Sanskrit curds is called as dadhi. So curds are not allowed in diabetes. Thereafter, then there are certain causes, that the chicken soups made up of flesh, that too from the animals which are living in the marshy land. So we feel that chicken soup or mutton soup or soup coming from any other non-vegetarian source, it is very, very healthy. But they have clearly mentioned that soups which are coming from the animals which are living in the marshy land, those soups, or what we call as a maunsaras, that is again, if it is consumed in a regular fashion, again it is a cause of diabetes. The third and most important thing is that which comes in a regular fashion, which is again can be a cause of diabetes, that is a regular consumption of milk in a heavy doses. People have a habit to drink milk early in the morning, to drink milk while they are going to sleep, and many of the people, they have milk along with their lunch and dinner also, or either or some recipes made up of milk, it is also consumed in the lunch or dinner also. So this excess consumption of milk can again land a person into diabetes. It has been proved by modern medicine also that milk contains certain antigens which can damage the beta cells of pancreas if it is taken in a regular way or in a higher doses. So anyway, when a patient have a strong hereditary of diabetes in the family, or the patient is having is into the pre-diabetic conditions, or if the patient is completely diabetic, then in all these conditions, substances like curds in regular way, then things like milk and all the milk products and soups or mouserus made up of the animals which are living in the marshy lands, that is to be completely prohibited. So thereafter, there are certain foods which is to be prohibited. There are certain grains, and specifically those grains which are very newly harvested. Means we know that when we go to the market, we see there is a old rice and there is a new rice. So there is lot of difference between the old rice and new rice. There are certain amino acids which are not settled into the new rice, which get settled into the old rice. So lot of chemical changes are there into the new grains and older grains, and all the new grains, it is said that they are very heavy for digestion. So all the grains which become older after 4 to 6 months after their storage, then they become old, and those grains can be consumed for the regular meals. So all the new grains, if consumed in a regular fashion, can land a person into strong indigestion, then gut inflammation, and then many more diseases. And specifically they have mentioned for diabetes. So Navannapanam Gudavaikrutancha. All the substances which are coming out, or all the recipes which are made up of sugar as well as jaggery. Jaggery and sugar, as glucose wise there is no difference, sugar wise there is no difference. So certain diabetic patients, they feel that okay, I am not adding sugar to my tea or coffee, I am adding jaggery to my tea and coffee, and they are satisfied with that. It's not like that. Means sugar is also not allowed and jaggery is also not allowed for any diabetic patient. So these are the things, and specifically what I want to again emphasize on milk, that milk should not be consumed in a regular way for all the patients, not only in diabetes but majority of the times in all the metabolic disorders. Milk can be a biggest culprit which can create many more problems, because we are not actually digesting milk very properly. We don't have lactobacillus in our intestines to digest the lactogen which is coming from the milk, and that can create more gut inflammations, and gut inflammation can create many more diseases. So patient who are into metabolic disorders, patient who are having a genetic prevalence of diabetes in their family, or genetic prevalence of all other metabolic disorders in the family, they should consume milk, but in a very smaller dose they should have, or even if they restrict milk at all, nothing happens. There are many people in the world who are purely vegan, that not only milk, they don't consume animal products, and they are very healthy. So it is again a myth among the people that milk is the most important component of their food into their life, but it is not like that. Some people they can digest milk very easily, some people they can't digest. In some diseases milk is to be restricted, prohibited completely. In some diseases it's okay, you can have milk. But when we talk about diabetes, milk and milk products, all sugar and jaggery products, all the substances which are coming, means more non-vegetarian products, they are to be inhibited. Along with that, all the new grains which are coming from the field, they are to be restricted in diabetic diet, and such type of diet which is having older grains, which is less with non-vegetarian substances, which is devoid of milk and milk products, and which doesn't have more sugar and jaggery added food, that type of diet diabetics should take in their food. So thank you very much.